this is an expanded version of what we had at the library because I go a little bit more into some of the treatments that we use in our offices. And then also I go into the co-infections that are very common with Lyme disease, as well as some other opportunistic infections that you get secondary to all of these infections. Because a lot of times what we'll see in people with Lyme disease is that it's not even necessarily the Borrelia that's causing the clinical symptoms. It might be one of the co-infections or one of the opportunistic infections, at least in the short term. And so there are perspectives that we look at on each individual basis to say what's going to be in the best interest of this person, short term, intermediate, and long term. And then really try to develop short-term, intermediate, long-term goals that don't necessarily counteract a different goal. You know, as an example, one of the things that we'll talk about today is antibiotic use. And of course, there are a few specialists in the area, one in Saginaw, a couple down at U of M that we have worked with, and you know, they're very big on prescribing people with Lyme disease very specific antibiotic regimens. Well, we use the same antibiotics clinically as well. However, what you have to understand is that using antibiotics to treat the Lyme and any of the co-infections is at some point trading a short-term symptom improvement for a long-term problem. And I'll get into more of why that is. And so there, on an individual basis, we have to try to balance that, because obviously we want the person to feel better as soon as possible, while not at the same time creating a longer-term problem that's going to have to be addressed in another year, 2, 3, 4, 5 from now, when that person may be on very marginal, if little follow-up at our office. And so this is probably the most clinically challenging problem that we face because there are so many presentations of it. It's very, very underreported and underdiagnosed. And it's transmitted in ways that either people are not admitting or won't accept in the conventional literature thus far. It was first found in Sweden back in 1909, or described in Sweden in 1909. Borrelia is the actual pathogen that causes Lyme disease. And it's a very specific type of a bacteria that lacks a cell wall. And these bacteria they call spirochetes. The significance of not having a cell wall is that it makes them very resistant to many types of antibiotics, because most antibiotics work by destroying the organism's cell wall. And when that happens, then of course the organism dies off. However, this doesn't have that. Now, the advantage for that, for the spirochetes, is that it's easier to hide within the body and make it undetectable by the immune system. The disadvantage is once the immune system can't find it and surround it, so to speak, it's actually very weak and very easy to kill for our immune system, assuming our immune system can find it. Okay? For decades, public health agencies of the U.S. and other NATO countries have denied the existence of cell wall deficient forms of bacteria or spirochetes. The lack of a cell wall renders them resistant to penicillin and penicillin family of antibiotics. And these work by disrupting the formation of new cell walls during bacterial replication. In 1982, Lyme disease was discovered by Willy Burgdorfer in Lyme, Connecticut, who isolated spirochetes belonging to the Borrelia family from the midguts of ticks. He showed that spirochetes reacted with immune serum from patients that had been diagnosed with Lyme disease. Subsequently, the name was given Borrelia burgdorferi. This is probably one of the more important slides here. It's been identified in human blood, semen, and breast milk. And even Vita Medical Centers has a YouTube video where they're very specific to say, you know, classically we think of Lyme disease as something that's transmitted from a tick bite. What we now know that it can be sexually transmitted, and the reason is that semen has a very similar immune disarming property that tick saliva does. In other words, when a tick bites you, and anybody who's been bit by a tick will know this, the head is literally buried into your skin and then it injects its saliva into your body. that saliva has a quality that knocks out some of the first responding immune cells that live in the outer layers of your skin. And they're called dendritic cells. And when it knocks out these immune cells, those cells cannot tell your body that there's an invader present. It's almost kind of like if you're taking out the watchtower people first before you invade somewhere. And so when that happens, the Borrelia has a chance to burrow into your body and start hiding in various tissues. And as long as the Borrelia is not active in your bloodstream, it's very difficult for your immune system to find, identify, and ultimately kill. Semen has the same property, because again, during intercourse, male semen is obviously is a foreign substance to the female's body. So there has to be some type of an inherent capability for that sperm to make it to the egg alive and fertilize the egg. So there has to be something in the semen that temporarily disarms the immune system to allow that sperm to make it all the way to the egg and hence fertilize the egg. Now, the one big thing, we're actually collecting, we have quite a few number of cases of this in both husband and wife in our practices. And it's almost a 100% correlation in men who have been diagnosed and their wives also have it. Now again, I don't know why, maybe there might be some diplomatically, let's say red tape things involved as to why this is not published, even though this is very well known. But I think there is probably an interest in not creating panic or fear among the population in these types of instances. But it does happen. And the problem is, this type of transmission is probably far worse because it doesn't leave any external symptoms. You know, as an example, if we go outside, you know, we go hunting, it's November, we're out hunting, I get bit by a tick, and I probably get a rash, or the classic bullseye rash. Well, as soon as I have that rash, I'm also going to get a fever, I'm probably going to get some pain, fatigue, etc. Typical flu-like symptoms. And when I have the rash, it's easy to identify that I have a Lyme infection. At that point, when you intervene with a normal antibiotic regimen, it's very easy to kill it off because the Lyme hasn't had time to hide in your body, replicate, and grow, and expand, and hide in basically every tissue of your body. However, when it's transmitted sexually or through breast milk to children, the problem is there are no overt signs because there's not an active response. Again, it's transmitted in ways that are bypassing your immune response. So clinically, we don't see anything. All of a sudden now, a year later, months later, 2 years later, after the person has initially been infected, now they start developing symptoms. And now it's already, by definition, more of what they classify as the chronic Lyme category. And much more difficult to treat that way, because now it's had those months and years to replicate extensively in the body, virtually undetected, and start burrowing into the different tissues of the body. There's a typical bullseye rash. This one is quite obvious. In chronic Lyme, and again, these are kind of the classic things that we see in a lot of people, and hence the problem with diagnosing Lyme disease in the first place, unless this is really something you're looking for. You know, I could list a number of people who have these symptoms and have never been diagnosed with Lyme and probably don't have Lyme. And so that's the inherent difficulty. And that's really kind of where we got involved with this at our offices, because we had a number of people coming in. I mean, I'm a chiropractic neurologist, so most of my patients are coming in for joint pain, low back pain, headaches, etc. So that's not an unfamiliar population to me. But what all of a sudden starts to happen is we start treating these people as if they have a musculoskeletal cause of all of these, and they don't get better. And so at some point, you have to ask yourself the ethical question, what in the world am I doing for these people if they're not getting better? And so you have to update your practices. And so over the last 4 or 5 years, we've come a long way to the point where it's so prevalent in our practice, and of course a lot of people know that we treat this very frequently in our office. I'm almost at a point where I try to rule this out before I even diagnose somebody as just having mechanical background. It's kind of like, I would rather prove that they don't have this first. And there's some easy blood checks to do to make sure that that's not the case. Bell's palsy. I've had a few cases where the person had no symptoms whatsoever. And their first symptom was just a random attack of Bell's palsy. No explanation for it, don't know what happened, nothing else is wrong, do a chest x-ray, there's no lung problems, nothing. And all of a sudden they have Bell's palsy. Widespread numbness, tingling, and burning. Now the quality of this is, again, if this was a musculoskeletal origin, the numbness, tingling, and burning would be pretty much a consistent nature. Always in my right big toe, or it's always in my right arm, or it's always shooting down the back of my left leg, and it doesn't really change in location. What can happen in people with Lyme, especially as the Borrelia starts to attack your peripheral nerves, is this numbness and burning will actually change anatomic regions. You know, one day you might wake up and you have some random numbness around your torso. A week later you're going to get up and your pinky finger will be numb, and it will randomly change. And the reason for that is the Borrelia, again, hence the name spirochete, kind of looks like a very small worm, and it spirals, basically making itself into a drill, literally, to burrow into the tissues in your body. As it spirals, it actually gives off a protein molecule that kind of diffuses almost like a noxious gas cloud away from you. And as that protein binds to the nerves, it actually destroys the myelin on your nerves, on your peripheral nerves. And the problem with that is once the Borrelia gets into your central nervous system, it starts bypassing your blood-brain barrier, it's in your spinal cord and your brain tissue. Now you're literally getting brain destruction. And there are MRIs of people who, they come on, they have lesions on their MRIs and they're told they have MS. But yet, follow-up MRIs 6 months later, a year later, and the lesions are gone. And those really aren't lesions or scarring from an MS type of an autoimmune response. They're lesions because the spirochetes have penetrated into the brain and become what we call a cyst form or a round bug. And so again, this is a very difficult bug to really get a hold of. Persistent headaches. Again, headache is a very generalized symptom. It could be hormonal, it could be musculoskeletal, it could be postural, it could be food allergies. So when we start to try to use all of these other solutions and they're still not getting better, there are only so many things that will contribute to this. And finally, once the Borrelia has started to impact the central nervous system, it does start to impair people's balance and gait pattern. It affects the way they walk, it affects, the person might not necessarily outwardly notice it consciously. Other people will notice it, other family members or caretakers. Or in the case, for example, it gets to be wintertime and there gets to be a little patch of ice on the ground, the person tends to be far less stable and feel less stable. And it might feel like that, start to feel like that year round. And that's one of the signs for us, and there are easy ways that we check this clinically to see if that's a potential issue. This is obviously far easier to look at the quality of numbness and tingling, motoring coordination, etc., without having to order an expensive MRI. Confirm what I probably already did. Memory problems, specifically short-term memory issues, including dementia. There are a lot of Lyme researchers that believe things like Alzheimer's dementia are really a subclinical Lyme symptoms. Depression or other emotional problems. I have actually a couple of they're kind of funny cartoons, but they, when you read them, they make me cry inside. Sleep disorders, insomnia. In other words, people will have one of two things happen. Either they can't fall asleep initially because they can't get their brain to shut off, or they can fall asleep, they just can't stay asleep. So they fall asleep, the drop of a hat, but an hour or two later they're up and they're wide awake and they can't fall back asleep. So one of those two situations. Chronic skin eruptions. Now, this is not necessarily from the Lyme directly, but from one of the underlying causes that contribute to the severity of the symptoms, and that is typically food allergies or food sensitivities. One of the classic well, I can say that a naturopathic physician that I know down in Clawson, when you walk into her office, she has a big wooden engraved sign on the front door that says, "When in doubt, treat the gut." And she basically treats everybody who you is any type, whether it's eczema or just random acne, and things where adults should normally get, that those are classic digestive problems and indications of food intolerance to some severity. Well, those food sensitivities and food allergies contribute to immune system dysfunction, and they have to be addressed if you want to get better. I think one of the advantages in our clinic, I guess, even if nothing else, but from the perspective and the way we view this problem, is that I think a lot of conventional physicians look at this as something we need to kill off. This person has Borrelia, let's attack it, let's destroy it, let's give it whatever drugs and medication this person needs to kill it, and then let the person recover. And a lot of times that works, at least for a while. But the other side of it is that all of us, on a daily basis, are exposed to a great many microorganisms. In fact, there are more microorganisms in our bodies, as we're all sitting here right now, than there are our own cells. Okay? So we're exposed to these things every day. So it's not really an issue of necessarily what's in our body all the time, as much as it is what is our body's ability to not let those things become problems. In a sense, building your body up and keeping it running like it's supposed to, so that it can better react when something does go wrong. Diagnostic testing for Lyme. The hard part is, we say it's diagnostic testing, but actually a Western blot has never really been held to be an actual diagnostic test for Lyme disease. In 1994, the CDC established a national surveillance criteria for Lyme disease, a national standard for reporting a positive diagnostic result that has never been developed. Most labs erroneously only report results based on CDC criteria, which were developed in conjunction with trying to create a Lyme disease vaccine. Certain key bands were omitted in the CDC test because these bands would react in people who had received the vaccine. A variety of reasons the vaccine was removed from the market, but the bands were never added back into the original Western blot test. And a lot of people at this point in time have realized that probably the reason that the bands were so reactive is that so many more people actually had Lyme disease than what they were at that time considering. Because again, even up to today, a lot of physicians still only consider this a tick-bite issue. 28 possible bands on the Western blot test, standard test, reports only 13 out of a possible 20. The standard test, Western blot version, only reports 13 out of a possible 28. Only 3 IgM bands are reported and only 10 IgG bands are reported. The difference between those, for people who are unaware, there are 2 types of memory cells in the immune system. There are the IgGs, which represent your body's long-term exposure to that particular bacteria or pathogen. Typically, IgG is something that develops once you've been exposed 12 months or more prior. IgM, it means that person was exposed to that particular pathogen within the past 12 months, up to within a week prior to the testing. The test is called positive if 2 of the 3 IgM bands would react, or if half of the IgG bands react. Unfortunately, the CDC has recently made the test even more restrictive. If a patient has a positive IgM response, it must be followed by a positive IgG response after 4 weeks. In other words, they're saying, if you actually are positive with IgM, that should, on its own, convert to IgG. And intuitively, that makes sense. The problem is now, other labs have added the initial 2 bands back in. And so now what they suggest, for example, IGeneX is a very big Lyme testing lab. They report a test positive if the patient has 2 bands in IgM or. So you could have 1 of each. Or you could have 2 in either category. They don't require so many in this category and this category. And the reason for that is very simple. We have seen it in our clinic a number of occasions. This short-term exposure, this IgM, will become positive when we test. And a lot of that is just, in reality, it's the luck of the draw. We randomly test that person and it became positive. If we retest that person 6 weeks later, this could be negative. And the reason that happens is because as the Borrelia burrow in and out of your bloodstream and in and out of tissues, your immune system sees it and then can't react to it because then it's gone. It's almost like whack-a-mole in a sense. Another kind of a debatable issue is that most doctors, even within the Lyme ILADS, International Lyme Associated Diseases Society, vary in their interpretation of the Western blot testing. For example, if a patient has a reaction even at a single key band, some physicians will consider this positive. There's even some disagreement about which bands are the most specific. In our office, we use something called Lyme ID by a lab called Neuroscience, and it checks bands 18, 41, 31, 23, 34, 24, and there's 12 total bands, or 13 total bands that it checks, with the original 2 added in. And those are the 13 bands out of all the original 28 that have shown the most sensitivity to detecting the problem. And the reason why they eliminated the other ones is so to allow people to have the test at the most cost-effective way possible. As an example, like Genix, if you get their full Lyme panel, I think the test runs of $700 or $800. I think it's a very expensive test, which is costly for a lot of people. My Lyme ID test, however, from Neuroscience, I think is $150, and it checks the most sensitive bands. So we're able to test a lot more people because the cost is much more reasonable. Since unless the person actually gets the bullseye rash, insurance will not cover the test, which again is probably the majority of the people. Of course, insurance, we're getting to a point insurance doesn't cover anything anyway. Another test that we use kind of as a screening test, and this is the one, like I mentioned earlier, any chronic musculoskeletal complaints that they come in, the CD57 is one of the initial screening blood tests that we run. The reason being is because it's an indicator of chronic infection. CD57 is a very specific type of immune cell, and there should be a certain number of them. Normal optimal is actually over 120. If it's below 100, then it's considered positive for Lyme. If it's below 60, then not only do you have the Lyme, but you're going to have also probably at least one of the co-infections and or one of the opportunistic infections. This is, like I said, this is the actual Borrelia, the spirochete. And you can see how it kind of has kind of a corkscrew shape to it. Kind of gross. In fact, you guys who saw me at the library will remember this background used to be the ticks in the background. I couldn't stand doing that anymore. The spirochetes basically exist in 3 forms. When it first gets in your body, again, because it's cell wall deficient, they are very susceptible to your immune system. So again, one of the big prognostic determinants early on is how well does your immune system work. If your immune system stinks, then there's a better chance that this pathogen is going to create a bigger problem for you as an individual. Does that make sense? So we still have to look at this. Yes, you might have Lyme. Just like probably all of us in here. How many of you have this? Raise your hand if you have not had chickenpox. Okay. So everybody else has had chickenpox at some point in our lives, right? Yet, that virus, that herpes zoster virus, still is in all of us at the present time. Okay? Not all of us, as adults, are going to get a shingles infection as a result of that virus. Why? Because there are some of us that have a better functioning immune system than others. Follow me? So one of the goals of our approach to this has to be to improve your immune system function and deal with whatever is causing it to go haywire. And that's another whole lecture almost. Okay, so back to the start. Spirochetes, or these, is considered the active form of the Borrelia. When the Borrelia are exposed to something that's antimicrobial, whether it's one of the antibiotics like doxycycline or flagyl, are the 2 common ones that are given for this, once exposed, a lot of them will kind of retreat and morph into what they call a round body or a cyst form. Okay? The problem with that cyst is that it makes it impervious to whatever antimicrobial is being introduced into the body, whether it's an antibiotic or an herbal or whatever it might be. These here are examples of the round. I know it's kind of blurry to see on here, but these are what the round bodies look like. What tends to happen then, once these round bodies form, the infection basically goes dormant. And at that point, that's when the person starts to feel better. Which is why we have people who come in, they're diagnosed with Lyme, they're put on doxycycline and or flagyl, and in 6 weeks, 8 weeks, 10 weeks, they start to feel better, and noticeably better. And they might feel better again for, say, 3 months, 4 months, 5 months. But what's happening over that 3, 4, 5 month time period is that these round bodies, or cysts, are starting to congregate and basically form little, what they call biofilm communities. So they kind of, it's almost like they have little, they kind of join all of their crystal matrix together to form one big one, which is called a biofilm community. And not only does this biofilm community make it impervious to any of the antimicrobials, it even makes it impervious to your immune system from attacking it. They cannot penetrate this biofilm. And then what happens over the course of time, 3, 4, 5, 6 months later, when your immune system starts to go down the toilet because you're having a stressful event in your life, or you're dealing with another infection, or something else happens, all of a sudden, these have replicated inside here to a critical mass to where then this blows open. Now you have active spirochetes entering the system again, and boom, you crash and you feel terrible. So when that ends up happening, you go back on antibiotics, and you're going to go on another round with them, and you're going to feel better. So the person ends up always doing this at 3 to 6 month intervals, while this just keeps repetitively happening. So the real key, if we're just talking about attacking the Lyme directly, you have to attack Lyme when it's in its active form, when it's in its cyst form, and when it's in the biofilm community. You have to do them all three at the same time if you want the best chance for the longest period of remission possible. And again, because there's no known cure per se, I mean, we all know what kills these things. The trouble is because we don't have testing sensitive enough or procedures good enough to measure the Borrelia content in somebody's entire body, we frankly don't have any real way of knowing if it's totally killed off or not. And until that day comes, we always speak of it in terms of remission to say, you're in remission, the infection is dormant, you may still have some Borrelia in your system, but as long as your functioning and your quality of life is vastly improved, we're going to keep doing the things to keep your body built up, so that should this start to happen again, your body will be better able to deal with it when that inevitably happens. Does that make sense? Biofilms are complex structures. Free bacteria become frozen in the gel-like matrix due to the result of molecular and genetic switching. And again, the genetic switching comes in where some of the Borrelia will become resistant to the antibiotics that were reduced. So it's kind of like they pass out little genetic samples to their friends and say, hey, look, you know, this antibiotic can kill me. You're going to try this too. Take this, it'll make you impervious to the antibiotic. So then now, not only do you have to go on antibiotics every so often, you now have to keep switching up the type of antibiotics because they become resistant so easily and so fast. Remember, for every one human generation that we go through, bacteria go through 8 generations. So they adapt much faster than we do. Biofilms release motile bacteria when environmental factors become favorable. Well, the environmental factor is our internal homeostasis and our internal balance. When that gets out of balance, we're going to cover today, which I couldn't get to at the library, we're going to cover what goes out of balance. Then this is freeze, we don't have a problem again. You know, quite frankly, if you have a biofilm community residing in your, small part of your liver, if that biofilm community never becomes anything else ever again, well, who cares, right? Because it's not causing a problem. Our trick is we now have to address this environmental portion of it to keep it from ever becoming a problem again. And that's where we get into trying to extend the periods of remission that everybody can enjoy. Bacteria within the biofilm are difficult to kill, of course. They exist in a highly protected niche. They frequently become extremely resistant to antibiotics and destruction to normal immune responses. Now, the actual biofilm, or the matrix, is made up mostly of heavy metals. Not just the bad stuff that we're exposed to, mercury, lead, tin, nickel, and some others, but even the stuff that we're supposed to have. calcium, magnesium, lead, copper, and even iron. So a lot of times when people who have Lyme will become anemic. And it doesn't matter what you do, they repetitively stay in. And what's happening is, as you're getting iron from your diet, the bacteria are hoarding it to make biofilm. So now you're not getting the benefit of it. Questions so far? Mike.
When you say reporting, it's unreported, is there guidelines that require reporting? Does it go to the CDC and the diagnosis?
Well, there's nothing to actually confirm the diagnosis in that. Again, we're going off on old tests. It's very, very restrictive in the first place. So yes, a lot of physicians will say, look, this patient has the symptoms of Lyme disease. We need to have them tested. They do the old Western blot test, and they're negative. So there's no more follow-up. They're negative, you're on. And until that testing aspect of it gets updated, it's not going to get any better.
Is there any other parasites that could mimic Lyme?
Yes. We're going to go over some. Yep.
I had mine in 1980. About killed me. Yes, I got over it. Felt good. Now, whatever got out, I'm back. Where does it stop?
Well, that's difficult to answer. Have you been tested recently?
Pardon me?
Have you been tested recently to make sure that that's actually what it is? I'm sorry?
I was in the hospital.
And they tested you?
I hope so.
Okay. Right, obviously, the first way to know would be to see what their lab reports are showing and see what actually what the labs they even ran. In a lot of cases, even a lot of local hospitals, their workup for this is...
Well, I mean, I ain't been tested lately, but I was tested when I had it. But now it seems like everything's coming back the same way it was when I had it.
Okay, and that's possible. I mean, I obviously wouldn't know until we did lab results, but it can certainly stay dormant for that long. Especially if it was something where you had it, you got an acute version where you had the rash, especially if you did get it from a tick bite. And they caught it early enough where they pretty much killed almost all of it, to where now it took an incredibly long time before it could replicate enough that now it can cause a major problem. Of course, that has to coincide with something environmental or lifestyle-wise, habit-wise, whatever it is, that allows us then to become a problem. Does that make sense?
What if the Western blot is positive?
If the Western blot is positive, then you can have Lyme disease. Especially the old, especially the original test, where they took out the two most sensitive bands.
And he said when mine came back, he had no problem. He said it was positive on both sides.
Okay, so IgM and G. Okay.
Did I hear you say you have a different way of testing?
Well, we don't use the original. For example, if a lot of physicians will use like Quest Laboratories or like Genesis or McLaren Labs, their own internal labs. Any of the local labs like that will use the old regular Western blot testing. To use the better versions of the Western blot, the more sensitive versions, you have to use the specialty labs, and there are only so many that do it. Fry Laboratories is one. IGenics was the one I mentioned up here, and also the one we use in our office is called Neuroscience. Those are the three main ones that a lot of functional medicine practitioners use, because they have those original bands added back in.
I had to send mine to California. They would not.
Yeah, that's Fry Laboratories. Yep. And I think IGenics is out there too. Somebody over here?
You mentioned West Diagnostics. They use the older form of the test.
Yes.
That's basically better.
No, the old test is much less sensitive. It's much less sensitive. The old test is not really the most accurate one. So if you had the old test and you were positive, then you really did. In other words, you probably have a very elevated count in the bloodstream in order to detect it. All right. The other thing, in addition to Lyme itself, is we have to talk about a lot of common co-infections that people can get with Lyme. These are bacteria and or protozoa that live also in ticks and are concurrently transmitted at the same time the Borrelia is transmitted. So it's very possible that not only do you have Lyme, but you also have one potential co-infections. The most difficult of them is the Babesia. And this is a normal human cell, and these are three, this is live blood cell analysis, by the way. These are the Babesia here, the three various species here. There are 20 known forms of Babesia. It's a protozoan. The problem is, even the best labs, even the specialty labs, only have the ability to look for a couple of them. So even if you test negative for Babesia, regardless of what lab you use, you still can potentially have it. And that's where the live blood cell analysis in some cases comes in handy. If the person shows all of the symptoms, then we're going to still treat them as if they are. Because in reality, some of the things that we use in the clinic are kind of broad spectrum in the sense that not only will it work on the Borrelia, but it will also work on this. That's the advantage of using a lot of the antimicrobial herbals that are out there, is that they'll kill a lot of this at the same time. Symptoms of Babesia infections. Air hunger, meaning kind of shortness of breath, feeling like you can't get enough breath. Cough, fatigue, fevers, headache, hemolysis, again, this is Lyme. Again, imbalance or balance disorders, in other words, without having the room spinning, the person just feels unstable on the feet. Mild encephalopathy, chills and sweats. Again, some of it just sounds like could have a bad flu. The problem is they never go away, or they wax and wane on very specific areas. Bartonella, again, it's gross. But also called cat scratch fever. Symptoms, again, spread by infected ticks, or also transmitted through placenta. Abnormal liver enzymes, encephalopathy, endocarditis, fatigue, headache, hemolysis with anemia, hepatomegaly, fever, jaundice, and lymphadenopathy, painful joints, myocarditis, splenomegaly, weakened immune response. Now this one clinically is easier to detect because again, it does leave the very obvious rash. And everybody who has Bartonella typically gets the rash. It's not like a Lyme situation where chronic Lyme people may have never gotten a rash. People who get Bartonella will have a rash, and it hurts and it itches and you can't stop it. And that's cat scratch fever. Ehrlichia, again, is another bacterial co-infection. Blue is it. This is actually muscle tissue. Again, also comes from infected ticks. This one actually is very commonly found in dogs and outside pet dogs and cats, but more commonly in dogs. There's another very similar bacteria to this called anaplasma or anaplasmosis. Technically, that is a co-infection, but also typically is more found in dogs than humans. But this still happens in people too. Elevated liver enzymes, headaches, joint pain. Again, so if you look, all the symptoms really kind of overlap in a lot of senses. Because really the symptoms, when you think about it, the bacteria itself is not causing the symptom. What do you think is causing the symptom? Anybody have a guess? Who's blurted out?
Byproducts of
I can say a lot right here.
the byproducts of
They're toxins?
cells.
Yep, that's part of it. The toxins, absolutely. But also our own body, in a sense, is causing this. For example, when we get flu-like symptoms, when I get a cold virus, the virus itself is not causing the symptoms. My body attacking it and reacting to it is what's causing the symptom. Does that make sense? That's why so many of these overlap. You know, our body only fights infections in so many ways, right? So if you start having a lot of the, diffuse joint pain, headaches, fatigue, white blood cell count goes up and down, etc., obviously the fight is. And then the trick is to figure out what it is. Opportunistic infections. We call them opportunistic because these are things that all of us are pretty much exposed to almost daily. And probably are residing with most, if not all of us, right now as we're sitting here. The only thing that determines whether or not we express symptoms of these is how well our immune system is at controlling their levels in our body. That makes sense? For example, Candida, can everybody read that? Try to make it as big as I could. This might sound familiar to someone. I'll read out loud. It says, why are you making such a fuss about this Candida business? I've already prescribed you an antifungal. I should have taken care of it. Even if you were to have this fungal problem the rest of your life, it's no big deal. The medication is perfectly harmless and can be taken indefinitely. Harping on about antibiotic poisoning and repetitive thrush syndrome is nothing short of hypochondria. Come to think of it, I could prescribe you an antidepressant for this obsessive neurosis of yours. How about that? There, everybody did. Candida obviously is a fungal infection. Candida systemic candidiasis. Many patients with Lyme disease have this because, again, their immune system is already trying to fight off other things. And so this, which is normally very easy for your immune system to kill off, now is free to kind of run rampant. The other way that this develops is because, again, when somebody initially is diagnosed and initiates treatment from Lyme disease, what do they typically go on first? Antibiotics. What do antibiotics do? They kill bad bacteria and they kill good bacteria, right? They destroy everything in your body. Okay? It's like taking a nuclear weapon to your body, to your digestive tract especially. Well, the problem is when you start on a course of antibiotics. Again, this is where I was talking about at the beginning, where we're trading a short-term effect for a long-term problem. By wiping out all of the normal good bacteria along your digestive tract, you now allow any bacteria that may have survived this atomic antibiotic blast to now replicate endlessly and now overpopulate your digestive tract. And then that's what causes this. And not only does it have to be bad bacteria, it oftentimes becomes fungal yeast. And that's why we see so many young kids who are on repetitive antibiotics for inner ear infections or whatever else who get oral thrush because they've been on antibiotics for them. So then they develop symptoms of food intolerance, oral thrush, etc. because they were on such intense antibiotics. High sugar diet is also another one that has to be totally eliminated. And I say that because I don't have one in the show. But one 12-ounce can of Coca-Cola, the sugar content in that 1-ounce can, 12-ounce can of Coca-Cola will totally inactivate your immune response for 6 to 8 hours. Okay? That's how bad sugar is for you. You do not need to eat sugar. Okay? In fact, if you look at, there are groups that call themselves like their calorie restriction societies. Their entire goal is obviously to live as long as possible. One of the primary ways that they do that is they limit total sugar intake per day to less than 30 grams and total carbohydrate intake per day to less than 50 grams. Now, to give you an idea, one can of Coca-Cola has, I think, like 45 grams of carbohydrates in it. So you drink one can of Coca-Cola and you're shot for the rest of the day. Okay? I mean, that's how much sugar. And you know how many people drink multiple cans of pop every day, right? So sugar is really a bad situation, not only because it inactivates your immune system, but in the case of Candida, sugar is what feeds Candida. It lives off of it. Okay? There's another kind of similar thing. Doctor, could it be something to do with my diet that's causing these problems? Now you're being delusional again. It must have to do with some deep underlying psychological problem. I'll switch you to Prozac and see if that helps. Sound familiar?
Well, you know, all my studying and stuff, they say a lot of doctors call that ibuprofen and I stand antibiotic, what you're taking. You know, we know they're antifungals, but they call them antibiotics. You ever go, some doctors...
Well, sure. They're not trying to split hairs with the general population. I get what you're asking. But you're right. They're antifungal medications.
Right.
Right. Another one, opportunistic infection, is called mycoplasma. This is the more common one, mycoplasma fermentans. Again, something, anytime you're in any air that's very humid, you're going to breathe this in. It's just a fact. Okay? So it's in all of our bodies probably now. You know, like, it only becomes a problem if our immune system cannot keep it at bay. Symptoms, fatigue, fever, insomnia, headache, bowel problems, joint pain, no response to antibiotics, and again, CD57 count less than 60, very commonly suggested. of the Lyme plus microcancer. This is a very difficult one to treat because of the motility of it. Again, it's very, once it's isolated, it can be killed very easily, but it has to be isolated. Again, when your body is over here trying to fight off Lyme or whatever other co-infections you might have in the system, this is going to be allowed to do what it wants to do, at least for a period of time. Again, look at the symptoms. Headache, joint pain, fever, fatigue, again, all flu-like symptoms. So it's our body trying to destroy this off that's causing us the problem. And once our body can fight these infections off, these all go away. So when we take any type of medicine, I don't care if it's something natural that I'm going to show you today, an antibiotic, whatever it is, the reason you feel better is because your body has finally killed off the infection. Okay? However long that takes. If you do it naturally and without having to resort to antibiotics, you're actually not only going to have a good short-term and intermediate response, but you also have a much better long-term prognosis as far as staying in remission once you overcome the initial symptoms.
You mentioned that one of these things could be caused from a blood transfusion. Do they test for that?
Nope, they don't. They have no screening test for it. Nope. Good question. So treatment goals, again, if we're talking about Borrelia or Lyme disease or any of the co-infections or secondary infections, the goals have to be A, we have to kill all three forms of the Borrelia. The active form, the spirochete form, the cystic form, around body, and then finally the biofilm community. You have to improve your immune response and immune function. You also have to maintain your normal digestive tract, normal good flora or bacteria. If you don't do that, you're going to have a longer-term problem, and you're just trading one issue for another. Secondly, you have to obviously eliminate co-infections. You're not going to actually feel better. In fact, in a lot of ways, the co-infections are what allow the person to feel better, even if you don't substantially in the short term lower the Borrelia count or change its status. Helping with co-infections allows the person to feel a lot better. With a couple of the other things, back up to the slides. I didn't put in. These are EBV, Epstein-Barr virus, causes mono, cytomegalovirus, and herpes simplex. Most of us in this room, at least, are probably positive for both the Epstein-Barr virus and cytomegalovirus. In fact, statistically, 8 out of 10 adults are positive for cytomegalovirus and have no issue because of it. Again, what's the only determinant of whether or not you actually have a problem with this? Your body's own ability to control it. Okay? Because we're all exposed to this. We can't get around that ever on this planet. So there are ways to combat viral opportunistic infections once those start to try to creep out and cause a problem. Because again, these viruses still hide in your body and they're dormant. Anybody who gets cold sores will know that. You know, the virus doesn't go away, it just goes dormant for a while. And it will come out when you have a stressful event, or you get a weather change. Anything that is a stressor to the body will allow you then to have a cold sore. Right? Anybody who gets it knows what I'm talking about. Okay. You see that kind of happening. Some of these quotes kind of stacked through here too. So, in addition to just looking at this as trying to kill off bugs, which again is an appropriate and necessary goal, we still have to do the other side of the coin, which is we have to build our body up to the point that it can do this on its own. You know, one of the things I always laugh about, I tell a lot of people when they start the initial phases of treatment, is, you know, they'll come in and they'll bring in to me a laundry list of medications, whether they're herbals, prescriptions, whatever they are. You know, how many people ever show a list or admit to a list of things that they take and feel great? Nobody, right? So there still has to come a point in time. I don't care if it's natural, I don't care if it's a prescription, antibiotic, what have you. There still should come a point in time where you can build your body up enough and do the things your body naturally needs to maintain health rather than just treat from the ground up all the time and kind of basically running on the hamster wheel. We have to build up the body. Worst thing about medicine is that one kind makes another necessary. Again, this is again the antibiotic. Again, we use antibiotics and everything. I'm not saying don't go on them. But I'm saying when somebody makes the decision to put somebody on them, it has to be done very judiciously on a case-by-case basis. You have to take that person sitting in front of you and say, look, is how they feel right now going to justify me or Dr. Strawman putting them on an antibiotic medication, knowing what that's going to cause down the line to make that person feel better? Sometimes the answer is yes, sometimes the answer is no. But either way, we're not stopping with just the antibiotic regimen. There are other things that have to be done in concert with it in order to mitigate what the long-term side effects of the antibiotic therapy are going to be. Now, the immune system uses basically what most people understand are called antioxidants. It's their primary weaponry that they use to kill off bacteria and viruses in our body. These are some of the main ones. Vitamin C, glutathione, magnesium, zinc, copper, iron, vitamin D, selenium, and omega-3 fatty acids. So in many of these, iron, copper, zinc, selenium, what ends up happening if you have Lyme disease, the Borrelia actually hoard those up for themselves to make biofilm. So now they're basically stealing, it's like the Iran-Contra affair. They're stealing weapons to use against your own body to protect themselves from your body. Okay? So one of the things that we have to do, in fact, it's a very good paper done, it was just before our daughter, about 15 months ago or so, where the entire theory of inflammation in the body, of course it's the inflammation that causes the fatigue, the fever, the joint pain, etc. That inflammation is, the ability for that inflammation to complete its cycle is dependent on your immune system's supply of these. And inflammation is described actually now by a lot of more progressive physicians in what we call a repair deficit. Meaning inflammation is going to occur in your body until these are in enough supply to allow the inflammation process to complete. Okay? It's almost like, let's say out here right now, we had a contracting company building a brick house. And they had a bunch of mortar sitting out here, but they had no bricks. And at some point, I mean, heck, they're on the clock, they're getting paid either way. So they're saying, hey, look, we'll be happy to finish this house once we actually get some bricks here. And they're going to stay there, they're going to hang around, they're not going to do anything until they get what they need to finish the job. The immune system is the same thing. It's kind of like the Army standing around with, I'm waiting for a gun here or something to be able to fight. So it's not going to be able to mount any kind of response if it doesn't have its normal supply of weapons, or antioxidants in this case. I'm going to go through each one of these. Vitamin C, glutathione, you can take them orally in various forms. Vitamin C orally is the best to do in a powder form. Glutathione actually is best to do one of two ways, either by what they call a liposomal liquid, or to do it by IV, because the size of the molecule is not allowed to be very easily digested orally and absorbed through the digestive tract. Magnesium, actually the best way to get magnesium is to bathe in magnesium or an Epsom salt, because it soaks right through the skin and the bloodstream and your muscle tissue very readily. Zinc, of course everybody knows zinc is good for the immune system, that's why we have zinc lozenges when we get a cold, etc. Copper is actually very important to test and replenish, because as people become iron deficient, they are naturally given iron and zinc to try to help replenish your iron levels. The problem is, when you take iron and zinc, they rob your body and they cause copper to be displaced from your cells, and you excrete your copper. So you can actually throw people into copper deficiencies if you give them too much iron and zinc, especially simultaneously. Vitamin D. Vitamin D is, to use an analogy I like to use, is that vitamin D is kind of like the general for your immune system, Army. Having low vitamin D is well known to actually be one of the factors that causes autoimmune responses. So if your immune system doesn't know what to attack, it just starts attacking everything. And now you feel really tired. And that's actually one of the primary drivers of Hashimoto's thyroiditis, which a lot of people with Lyme also. Selenium, again, is one of the minerals that Borrelia used to build up biofilm colonies. It's also one of the most important minerals, along with magnesium, to convert T4 thyroid hormone into T3. So if you don't have enough selenium, that can actually drive clinical hypothyroidism. And of course, what then ends up happening is you get put on Synthroid, which is just T4, and it doesn't really solve it. Because all you're missing is this one converting enzyme. And then you feel better. And of course, omega-3 fatty acids. Depending on the clinical symptoms of the patient, there's one of two forms that I would typically choose. Fish oil, of course, is what most people are aware of with this. However, if the patient has a situation where they're having a lot of neurological symptoms as a result of the Borrelia infection, I will elect for krill oil instead of fish oil. And the reason being is because fish oil is in what they call a triglyceride base, which is very good for the cardiovascular system and very easily circulated through the body. Krill oil, on the other hand, has a phospholipid base, which allows it to cross the blood-brain barrier and go directly into the central nervous system. So, to translate this into another example, autistic children, or ADHD kids, etc., do better with krill oil supplementation than they do with fish oil supplementation for their particular symptoms, because we're getting it delivered right to the central nervous system. And of course, depending on where this gets processed, helps limit the amount of inflammation in that area. Other things that are very important, they're called transfer factors. And there are some different companies here I put down that make different versions of them. Transfer factors are basically immune system components that in a natural setting are passed from mother to child. Transfer factors are very heavily found in the colostrum and breast milk. Transfer factors are very heavily found in also chicken eggs. In other words, obviously when a human mother has a baby, or a cow for that matter, any mammal, their child is breastfed. Their mom transfers these transfer factors to that baby to help the immune response, kind of teach it immune response, if you will. However, in a chicken doesn't breastfeed, obviously. So when mom lays an egg, these transfer factors are put into the egg to sustain that chick for a period of time. So a couple of companies have come out with different versions. For Life Research is one company. Again, I don't have any part with any of these, but you're free to look them up online. For Life Research has something called transfer factors. There's another company called Research Nutritionals. One of the main spokespeople for that company is Joe Birascano, who is one of the big Lyme lecturers for the International Lyme Associated Diseases Society. This is actually his formulation. His formulation is specific for Lyme disease and some of the co-infections. And then there's something called I-26 hyperimmune egg donor. And again, kind of along the same line as taking the entire chicken egg, dehydrating it down, and taking all of those transfer factors in supplement form. So these are also very helpful in concert with these antioxidants. Because this helps, what these do in a basic sense, is they help your immune system more easily target what is you and what is not. These also help your memory cells of your immune system attack foreign pathogens much, much faster. So again, when we're dealing with Borrelia that might be in and out of the bloodstream very rapidly, it's better to have this stuff so that as soon as it enters the bloodstream, it has a higher chance of being attacked and killed off by your immune system. Questions about that? Yes?
I just wanted to say that going out and just taking these things with humility probably isn't a good idea because you need to have a strategy.
Well, of course. And to me, Willie, I mean, again, if you're going back to like this list here, other than the three middle ones here, the zinc, copper, iron, the rest of these, in reality, you could take with you. Now, in reality, you probably don't need all of them. So at some point, it just becomes more of throwing your money away to help the problem versus actually causing a problem, like a health problem.
I think what I deal with, I think I have Parkinson's problem with the knees. And gone through the last 20 years, allergies and candida and just all sorts of stuff. But I always try to find natural stuff like handle and all this natural stuff, all this stuff. And I think it just go along with the problem, even though the problem's going to be around for probably what it is at the time.
Sure. Or not necessarily prolong it. It might help keep it at bay for as long as it's been.
Yeah.
And then that's how it is. But maybe it just needs to be more targeted based on what's actually going on.
Is there a product that has all of these as balance for someone like lower needs?
That would be a great idea for a product, but there isn't right now. Only because the optimal mechanisms of delivery for some of these are different. So you really couldn't make one product that would give you optimal levels of all those. As an example, if you were to put them all in a capsule and take, because there are a lot of glutathione capsules available. The problem is, if I take an oral glutathione capsule, I might only get 10 or 15% absorption from that oral capsule. Because glutathione is very expensive, you have to take a lot of it to get the normal clinical effect you might get. So that's why we always try to go what's already established as the most optimal absorption routes for the various antioxidants, because they're all different.
I took the transfer factor for over a year and had to quit because it was so expensive, so.
They are pricey, you're absolutely right. Sorry,
And
absolutely.
did it help me at all for taking it at that length of time?
Well, sure, of course it will help to some extent, but there's still a certain amount of, these work on a much different mechanism than the antioxidants do. So, as an example, let's say you're on, and so it's now easier for your immune system to target the bad pathogens. The problem is if it doesn't have a weapon, but you still can't do anything about it. It's like, oh yeah, there you go. And then I'm just continuing to stand there, you know what I mean? So, it's not the whole picture. It's a big problem. Sorry, I know it's going a little bit longer. Yeah?
And there's actually an issue for RA, having a strong immune system is not attacking you. So if you build up your immune system to fight the Lyme, you actually build the immune system to enhance the RA.
Well, yes and no. That's a good question. What you have to do, though, is figure out what's causing action. In other words, there's something about that person's immune system that is not correctly targeting friend from foe. And there's always a reason for that. It's just from person to person finding out what that is. One person might be, as an example, gluten intolerant. This person might have low vitamin D. This person might have a chronic Epstein-Barr infection. There are a host of reasons that can be triggering that autoimmune event. It's just finding it from person to person. That's the main.
Remember, before this is actually autoimmune suppressant. When you have RA, it's when it's
Right, yeah, John, yeah, absolutely. John Admiral or something else that likes everything. Yeah, I know. Feel great, but then there's a reason they tell you to get lymphoma. So, but I will say, you're right in the sense that that's why you can't give people with autoimmune diseases like RA things that just arbitrarily ramp everything up, like echinacea, as an example. It's an herb that's a very powerful immune stimulant. Right? People with autoimmune disorders, totally not indicated. Good question. Okay, another thing that never really gets discussed, and again, the conspiracy theorist side of it says that it's probably intentional because there's a lot of money to be made off cell phones, etc., and Wi-Fi, is exposure to electromagnetic radiation and radio frequency. Because it does vibrate our cells and it does cause damage to our bodies. Robert Becker is an MD. He wrote a book back in the 80s called Body Electric, a book that was way ahead of its time. And he was basically called everything including a quack, which is normally referred to weak chiropractors. And they actually called him a quack. Okay? I have no doubt in my mind at the present time the greatest polluting element in the Earth's environment is the proliferation of electromagnetic fields. And this is back in the 90s when this quote is attributed. So this is, I mean, today, how many more places have Wi-Fi? You know, every Tim Hortons, every Panera Bread, every place you go in has Wi-Fi capability. And we're always being exposed to that. And And a lot of the progressive researchers, there's a very good researcher's name is Dietrich Klinkhardt. He's an MD, very big Lyme literate MD, as they call him. It's very, very, in fact, probably it's more of an emphasis than most Lyme physicians do. By saying that you have to take the steps necessary to totally eliminate this from your house and your daily life as much as humanly possible. Because you will not totally get better until you can reduce your exposure to this. And they actually predict, Dr. Klinkhardt predicts when somebody will have a good therapeutic response and when they won't, based on their daily cumulative exposure to EMR and radio frequency. So this is nothing to take lightly by any means. You know, if we get exposure from all over, I mean, how many of us have our cell phone mounts right now and it's on? Maybe it's just on vibrate. You know? How many people use it in your car, even if you have hands-free or whatever else? How many of it is on? How many of you use your phone in your car? Let me ask that another, okay? You people who raise your hands realize that your car is made of metal. So when you're using your cell phone in your car, you're actually increasing the strength of the signal intensity from that cell phone. It's actually amplifying it into your body, okay? Never use Bluetooth. You know, when you have the hands-free, but you have the earpiece, that actually puts the radio frequency right into your brain. Of course, everybody basically who is not tied to a cell phone company or a telecommunications company will tell you that Bluetooth causes brain cancer. Okay? Use an earthing blanket on your bed. Is everybody familiar? Anybody not know what an earthing blanket is? A few people. An earthing blanket is basically, for lack of a better term, a bed sheet with a small amount of wiring network built into the sheet. That sheet then is connected to a wire that you plug into the little round outlet here on the wall outlet, it's the bottom hole, and it actually drains the electrical activity from your body while you're sleeping. There's a very famous, in professional circles, integrative cardiologist named Stephen Sinatra, who wrote a book called Earthing. In fact, you can go on Amazon and buy the book, you can even buy the Earthing. You get the whole kit. I think it runs around $200 for the sheet and the book and the whole thing, the wiring and everything. And use that on your bed. We have one on our bed that we've used for probably, I think we started using around 2006 or so. You can also get similar devices to put on your computer, or to put under your computer tower, under your keyboard and your mouse, under your feet while you're sitting at the computer. Again, to keep all of that energy from draining, or from absorbing into your body. If you have Wi-Fi in your home, which a lot of people have routers that are Wi-Fi capable, you have to eliminate that out of your house. Because again, what this does is this gives energy to pathogens. You know, I mean, this is all energy waves that enter your body, they disrupt your own cells, and they actually stimulate more activity on pathogenic cells. So everything in your body that's bad gets amplified when you're exposed to Wi-Fi or electromagnetic radiation. Do not use the, I forget what they would call them, CFL bulbs. Switch to the LEDs, or just use the regular old, Thomas Edison incandescent bulbs that are far better for you. Some places it's actually getting hard to find now. The LEDs are far better for you. The CFLs actually emit a lot of electromagnetic radiation. Do not keep your alarm clock next to your bed because you will soak that into this. Because most people usually, if they're laying here, it's right here, and that's by your head all day. Avoid restaurants with Wi-Fi, like I mentioned. Tim Hortons, Panera, a lot of them very readily advertise it even on the front door. Do not use metal furniture in your house. It also amplifies the signal of anything outside of your house. For example, if you're somebody who lives in an apartment complex or a townhouse or a condominium complex, you're probably around other people who have Wi-Fi even if you don't. So you need to take the steps necessary not to amplify the signals coming into your house from other external sources. And this is also where this last two come into play here. It's actually called Eye Shield Paint. I'm going to give you a website where you can go and look for all this kind of stuff. There are two websites actually. And the other one is called a Faraday cage. And what it is, it's basically like a metal, everybody knows like the mosquito nets they use to help protect against malaria. It's a similar type of product, but it's metal, and it keeps everything, it keeps EMR and radio frequency from It makes a barrier between you and the outside of your bed, basically. You put it around your bed, similar to like a mosquito netting effect. And it helps keep that out, especially if you are in an apartment complex, whatever. So I know a lot of people are probably looking at me like, where in the world is all this coming from? But the reality is, and a lot of people in here, I already know you, and I already know you know, that you have to be all in if you want to have the biggest chance for success. You have to be all in.
Don't you do anything with accumulates or all this devices that a person, like accumulate, or there's a lot of things.
So like the necklace and bracelets and all that?
You can wear.
Well, I don't. The reason why we don't tell people to not wear them, but actually that gets to the final point on here. There's a company, and this was actually started in Germany by a doctor named Winifred Docha. And basically he discovered this concept of destructive interference. In other words, electromagnetic radiation, radio frequency, are just energy waves. They just have a different frequency which classifies one from another. What he figured out was that you could take a counter wave, apply it to that wave, and cancel it out so it protects you. And so now they have products that can work on this concept that you can attach to your cell phone, you can attach to your alarm clock, etc., to keep your body from absorbing all of that electromagnetic radiation and radio signals. And I'm going to give you the website for that too. And it's actually called MAMON, M-A-M-O-N, I believe is the spelling, therapy. And there are all sorts of products that you can get to help with this concept. Similar to like the Q-ray and bracelets and so forth. Okay. Questions about that? Yeah.
So what you're talking about with the lighting, you're talking about those new bulbs that are...
Yeah, those swirly bulbs.
Swirly bulbs.
Terrible.
Get rid of them.
Get rid of them. Terrible. Absolutely terrible. Not only that, but if you break them, they emit a ton of mercury. So, I don't see the upside.
Does it also interfere with the telephone next to your bed?
Yes, especially if it's cordless. That was another thing I forgot to add there. Don't have a cordless phone. Even if it's a regular landline phone, do not use a cordless phone. That's another one.
Just cut the energy off, and the rest of all you see how the energy with it, off.
Yeah, yeah. But that's why I was saying.
Over the energy involved, it's getting bottom more.
Yeah, yeah. Absolutely.
We're getting it.
We're saving money and costing health. But that's why I say if you have the choice and you want to, because they're even more expensive than the CFLs, is to do the LEDs. They last a lot longer than the CFLs are supposed to last. Now, granted, they're much more like a regular, like a floodlight.
Don't they get hot?
No, they really don't. We have them in our kitchen. You know, we have recessed cans in our kitchen. It's like a 60-watt floodlight bulb, but the LED version is like $35, $40. I mean, they're expensive, but they're supposed to last like something like 50 or 60 years. So.
I was going to say too, you can buy a little meter that reads EMFs.
Yep.
When I was looking for a house, every time I went to a house to look for it, I had my EMF reader on all the time, because even when a furnace goes on, some houses, furnaces would hit 10, we have to go 3 and under. So I didn't even buy a house to that, everything in zero, because that's how bad it is for you, especially in
Yeah, no, that's a good point. In fact, one of the things that I was just reading a few nights ago is in a lot of countries, they don't allow families to live within, I think it's 600 or 800 feet of power lines. And children who live within 600 feet of power lines, as opposed to children who live 2,000 feet or more from a power line, about half a mile, are 400 times more likely to get a childhood cancer, leukemia, or whatever else compared to kids living close. Now, this is a sad but true story. Friends of my wife's stepsister have a cottage up north. And I think it's called Woodland Lake. And we went up there July 4th week a few years ago. And they have a couple of young 10 and 12-year-old kids. And they have out, if, for example, this stage is the back of their house, they have power lines a little farther than where the back wall is this distance. Maybe like another 50% of this distance. They actually sent their kids out with 4-foot fluorescent bulbs And when they got into the lines, the ball, they could actually hold them up and they would light up. And of course, these people are laughing and this is hilarious. And I'm thinking, holy crap, what is going through these kids' bodies? And of course, we're friends, so they look at me like, what the hell do you know? And I just cried because I don't know what to even say to them. And it's unfortunate, but there are a lot of people who just don't know. And I think there is an interest in people not having access to this information. Because how many people want to use a cell phone that's going to cause cancer? How many people want to walk in somewhere that has Wi-Fi and all this other stuff? Because a lot of people say, hey, look, my cell phone and having the ability to be connected all the time makes me far more productive, especially if I'm in business for myself. And I understand. But at some point, it's the old Chinese proverb, a young man spends his health to obtain wealth, and an old man spends his wealth to restore his health. So it's, it's just one of those decisions we make. Okay, anyway, back to the idea of building up your body. Again, I appreciate everybody coming out when it's so hot and it's warm in here and it doesn't appear to be AC. Is it takes two to make a quarrel, so it takes two to make a disease, the microbe and its host. Again, the idea that just because you're exposed to something doesn't mean it necessarily has to cause a problem. It's still about what is your body going to do about it. One of the main areas that we have to look at in everybody, and especially early on, is their adrenal status. And the reason being is very simple. Look at what it does. Look at what your adrenal glands do. They control blood sugar, blood pressure, inflammation in your blood vessels, vasoconstriction, protein mobilization, which allows your body to make energy, electrolyte balance, thyroid hormone transport, inactive to active thyroid hormone conversion, and it initiates all stress and immune system responses. Okay? So, if you come in contact with something, your ability to fight it off right from the outset is going to be dependent on these two specific glands, right? If they're not working, you're going to get sick. It's just as simple as that. Now, what do you suppose causes the adrenal glands to go haywire? Loud, right? I hear something. Stress, good. Nobody has stress, right? Not in here, probably. Nobody ever has money problems. Nobody ever has marital problems. Nobody ever, has problems with their children or taking care of their parents. Maybe they're in a retirement community or something. Nobody ever runs into any kind of stress. Well, historically, everybody's familiar with what we call the fight or flight response, right? In other words, early in our history, stress to us was somebody is trapped under a car, okay? So what happens? Adrenal glands kick in, we make adrenaline, we walk over, we lift up the car, pull the person out. In fact, it was just on the news the other night on Channel 7, I don't remember where it was at. But 3 or 4 people went over, lifted up the car, got a daughter. You guys saw that? Okay, all right. So we know that happens. But the issue is, the main difference is that once that stressful event is over, your body now then is allowed to go back to baseline. And it doesn't have to keep making adrenaline and your stress hormones. Okay? So these glands are not something that are supposed to always keep working. But in present-day society, with exposure to EMR and radio frequency, it vibrates these and forces them to always become activated. Hence the importance of limiting exposure to radiation and radio frequency. Not only that, but again, we do have problems with family, money, job, etc. And we never seem to get away from it. So what ends up happening is we hit a stressful event, we start making stress hormones, but we never are allowed to come back down to baseline. And we just stay up here. And they actually call that general adaptation syndrome. And over time, what ends up happening is the adrenal glands, which is much the same comparison as to somebody who becomes type 2 diabetic in the pancreas, at some point just wears out and stops making insulin. And you become type 2 diabetic. Your pancreas cannot keep making insulin if all you're going to do is eat sugar and carbohydrates. It's just a fact. Adrenal glands are the same way. They're going to hit a point to where they're saying, you know what, I just can't make it anymore. I'm done. And so now you fall in, now you crash. Many people now get heart palpitations, depression, You might have a nervous breakdown. A lot of things can happen when that person crashes. And when that happens, now you're in what they call full-blown adrenal fatigue. And I don't care what pathogen we're trying to kill, you're never going to recover until your adrenal fatigue is dealt with. So very early on in our protocols, almost everybody has to have this addressed in the short term if the rest of the stuff is going to have a chance of working and keep that person staying better for the long term. Okay? Adrenal insufficiency, or adrenal fatigue, depending on what stage it's in, causes impaired detoxification. So again, if we have an accumulation of heavy metals, because we don't have the ability to remove them from our body, who uses them? The little worms we're talking about that we use, right? Spirochetes use it. Why? Make biofilm. Why? To protect themselves from you. So if you cannot detoxify, you don't eliminate the heavy metals out of the system in the first place, and now the pathogens can use it to protect themselves from it and make themselves more virulent. Causes tachycardia, especially the things where, whoa, I got up too fast. And it's kind of like it takes a second. Those types of postural hypotension or tachycardia, rapid heart rate in response to quick changes in posture. Dysautonomia is just the autonomic nervous system not working well, which leads to heart flutters, it leads to shortness of breath, it leads to panic attacks, leads to insomnia. Insulin resistance or pre-diabetes, because again, it's not controlling your blood sugar effectively. And one of the initial stages of insulin resistance pre-diabetes in relation to this is actually hypoglycemia. So people who say, you know what, I don't have a blood sugar problem, I'm actually hypoglycemic. No, you're insulin resistant and you're just in stage 1. Okay? You will end up becoming type 2 diabetic in time. Continues. Hypothyroid symptoms, again, from lack of conversion into active thyroid hormone. Chronic fatigue, because again, you're not producing your steroid hormone, so it helps, not only you're getting lack of steroid hormone production, but you're also getting lack of energy production on a cellular level. And of course, finally, for all the co-infections, and especially the opportunistic infections, it impairs your immune response. Diagnosing adrenal insufficiency. Anybody have adrenal labs done here? A couple people. Everybody, saliva, blood, how are you guys doing? Saliva. Saliva is the best way. A lot of doctors will still do them on a blood check because it's easy to collect in an office and easy to process. The problem is when you do it in blood, you're not actually getting tissue measurements. In other words, by the time you measure it in the saliva, you're getting the active amount of that hormone that's in all of the tissues in your body, presumably. So it's a much more sensitive value. And the difference is also we do 4 collections over an entire day. In other words, from the time you wake up in the morning to the time you go to bed at night, there's a normal curve that those 4 collections should fall within. Your levels of your adrenal hormones should fluctuate very particularly throughout the day, gradually decline. If that's off, then we intervene appropriately depending on what part of the day that person is not producing correctly, or if they're in full-blown adrenal fatigue, instead of having a nice smooth declining curve, those would be flatlined in the test, and all 4 points would be very bottom. Then at that point, the adrenal glands have to be rebuilt. That's where we talk about things like glandulars to help rebuild the adrenal glands, and some other rapid things that I'm going to go over here in a second. We typically use one of these 3 laboratories, depending on the person's insurance. Some will cover diagnostics, some will cover Pharmason compared to Genova or vice versa. So these are the typical labs that we use. They all offer the saliva testing. And among those labs, it's all pretty much processed the same way. So we get a pretty consistent result. Causes of adrenal insufficiency: sugar, caffeine, alcohol. Food allergy sensitivities, environmental toxins, pesticides, metal, BPA are all examples, and emotional stress is probably one of the biggest ones. In fact, there's kind of a cyclic effect between emotional stress and adrenal insufficiency in that they kind of feed into each other. A lot of people will come in and say, you know, I don't know why, but stress affects me very easily, and I can't seem to react and adapt to stress very easily. You know, I can be having a great day, somebody will call me and tell me they had a flat tire, and all of a sudden my whole day is shot. Well, for most people, telling them that they had a flat tire shouldn't be like, okay, well, what can I do to help? Well, no big deal, it'll get fixed. But some people, something basic like that will cause them to just crash and the whole rest of their day is done. And they're either depressed, or tired, or in bed, whatever it is, because they're shocked. Their adrenal glands cannot handle it. So, this is a very big part of the puzzle that has to be addressed early on. And of course, again, the stress in that person's life is always ongoing. And it never seems to end because, again, they don't know how to deal with it. And, quite frankly, they don't have the ability to deal with it in the first place. One of the protocols we use in the office to try to get a more rapid response, especially people who are coming in that are really not in the greatest shape early on, is to do IVs. And the reason being is because it's going directly into your bloodstream. You don't have to worry about malabsorption issues that a lot of people have because they've been on antibiotics. And so their digestive tract is terrible. And we can bypass that early on and then switch them to the orals as they start to recover and their digestion starts to improve. So these are the things that we'll do in an IV regimen for people to get them better faster and to get them more independent of us faster as well. So as an example, vitamin C, glutathione, glutamine, vitamin B5, or pantethine, and magnesium. The one thing that we always are very important to say, vitamin C we use is unfortunately a little bit costly because it's not corn-based. Most commercial ascorbic acid that you buy, especially if it's cheaper, is going to be made from corn. And unfortunately, a lot of people have corn allergies or sensitivities. So if you give this to them, you're not actually going to absorb or utilize any of it. And so that's a big problem. So we actually, the vitamin C that we use in office for the IVs is actually from something called a cassava, which is a vegetable-based. And most vegetables people are okay with. They might have false positives on some of their food sensitivity testing, but that has more to do with the leaky gut issue, which is a separate entity. Glutathione, again, it's one of the big antioxidants. Serves a couple of purposes. First of all, glutathione helps your body recycle vitamin C. So when you use the two of them together, for every 1 milligram, as an example, of vitamin C you take in, it will work the equivalent to 3 milligrams of vitamin C because it's being recycled by glutathione. Glutathione is also a natural detoxifying agent. So in people who have detoxification problems, genetic or environmentally induced, this will help them jumpstart that process as well. Especially basic functioning is kind of a natural alternative to traditional chelation therapy. Glutamine is another amino acid that we use. Glutamine is used by the little villi in your intestinal tract and helps rebuild those villi. In other words, if let's say we were all standing in somebody's digestion in their large intestine right now, the floor should normally look like a really high pile of carpet. Okay? And all those carpet fibers are the little fingers through which all of the nutrients are absorbed from your food. Okay? As that pile wears down, when you have chronic inflammation in the intestinal tract, you no longer get absorption. And so those piles have to be literally rebuilt. And one of the main amino acids that does that is L-glutamine. Vitamin B5, and of course you can't really get B5 by itself. We use a B complex, but for the fact that it has the B5 in it. Vitamin B5 does a couple of things. First of all, vitamin B5 is one of the main raw ingredients from which most of your adrenal stress hormones are made. So it's basically giving your adrenals some of the raw materials it needs to make hormones again. And finally, magnesium, which accounts, depending on which author you read, anywhere from 300 to 500 different chemical reactions in the body are entirely dependent on magnesium status. And so for us, adrenal-wise, especially people who have really got to where the adrenals have affected them psychologically, the magnesium helps with that. It helps keep them calm. It helps keep them more in an even keel, per se. And of course, then also it addresses a lot of the inflammation and joint pain that people get when they do have Borrelia and a lot of the co-infections. Dietary-wise, we have people eat small, frequent meals. Reason being, large meals tend to overburden the adrenal glands and make them have to work harder. And B, skipping meals also taxes the adrenal glands because your adrenal glands have to produce some of your stress hormones to get your pancreas to make glucagon to help regulate your blood sugar. Okay? So if you don't have those, your adrenal glands are forced to have to work. So the whole premise of this protocol is to minimize the need for your adrenals to work at any given time. Okay? Foods high in good fats, coconuts, raw almonds, etc. Any of you who comes into my back office will see at any given time, whether it's Dr. Stockman's desk or my desk, a big bag of raw almonds, dried, shaved coconut, and very small bits of organic dark chocolate. And that's kind of like our trail mix. That's kind of what we snack on throughout the day. Very incredibly healthy. Good in all the high fats, and of course the dark chocolate has very high antioxidants. And, frankly, it tastes pretty damn good too. Vegetable-based protein. You have to have protein because you have to have the amino acids to repair. The problem is, again, because most people in this scenario have a very poor functioning digestive tract, they don't absorb and digest protein out of their diet very easily. So early on, we will recommend that they switch to pea protein as the optimal one, because pea protein is actually already partially broken down. So it's very easy to assimilate. You can get high concentrations of it, especially from different dietary powders. And of course, there are different proprietary versions. If you go to Rebecca's, they can get you whatever you want. And this works far better than animal proteins early on. Okay? Next, not out of a box, not out of a can. The fresher the better. Make your own chicken broth. The reason being, again, chicken broth contains a lot of the amino acids and a lot of the core elements that were found in the chicken bones. So it's an easy way to get a lot of animal-based proteins that are already very readily available and absorbable for your system. The chicken broth also contains a lot of immune-enhancing properties to help you fight off your infections. And then finally, apple cider vinegar. The reason why we have people take this, we'll typically have them take it before their meals. Typically, if they're taking it small, frequent meals throughout the day, we might have them take half of a teaspoon with the meal every time they eat. And what this does is this helps a lot of people who, again, when their digestive tract is not working, they're actually not producing enough stomach acid. Which again is counterintuitive to what a lot of people are told, that they're actually making too much stomach acid, so they put on a Zantac or a Nexium or whatever else. When in fact, it's the opposite that's actually true. And adding the apple cider vinegar into the diet will help you break down all of the protein out of your diet better and utilize it. Not to mention, the apple cider vinegar has a very positive effect on your weight, on your blood pressure, and your cholesterol levels. So there's a multitude of things. Questions also on that section? Yeah.
Any chicken broth that you can buy, you have something.
Well, if you're not going to make it, then at least get the organic versions.
Kind of paying blood to make chicken broth. I'm just saying, the chickens are actually.
Just buy a roaster chicken, eat the chicken, eat the carcass, roast it, have 3 or 4 cups a day of chicken broth after you boil it. Well, please, free range chicken. Yeah, absolutely. No antibiotics, none of the crap. You know, whenever a doctor cannot do good, he must be kept from doing harm. Now we get into some of the antimicrobials. Study just out a couple of years ago, 5 antibiotics tested on the 3 various forms of the Babesia, or sorry, the Borrelia. Doxycycline, which I already mentioned, reduces the active spirochete count by 90%. But it increases the number, almost doubles the number of the cyst forms of the Borrelia. So if all you're doing is killing it, you're converting it from one to another, you're not really killing it off. You're not really solving the problem. Amoxicillin reduced spirochete forms by 85–90% and cyst forms by 2/3. And treatment with metronidazole, flagyl, led to a reduction of spirochete by 90% and router body forms by 80%. Now, here's the problem. Even when you're doing any combination of these 5 antibiotics, yeah, we might be getting 2 of the 3 forms, but at best, we're only killing off half of the biofilm colonies. So we're still leaving half of the original bacteria in the system with an antibiotic regimen. Now granted, maybe that entire remaining 50% might have gone dormant and you're going to feel better temporarily. But it's only a matter of time before this starts to crop back up and then you're going to crash it, inevitably. So in that time, like I said, even in office, I'm not necessarily against antibiotics on an individual basis. I am against everybody arbitrarily getting them, and I think there are doctors that do arbitrarily give them to everybody who has Lyme. And they don't look at the individual factors. But once you can address this, if I only have half the bacteria left, and now I intervene with my adrenal support, my dietary support, addressing co-infections and opportunistic infections, my chance for this to stay in remission far longer is going to be that much better. And that's really what we're trying to accomplish. So to get those biofilm colonies, nutrients that we give to people to help break up the biofilm are lumbrokinase, nattokinase, serrapeptidase. And we have some of these here that you guys can look at. Let me come up. There's some over there, I think, too. In our office, we have actually switched from using nattokinase to lumbrokinase because it has 500% more activity for the same amount. Or it works 500% better. But you also, regardless of whichever one of these you choose, you still have to use it with serrapeptidase. For whatever reason, they work synergistically and they work far better than using any of those by themselves. Lactoferrin, royal jelly, of course, these are kind of like one of Mother Nature's elixirs for a lot of things. Alkalinizing agents, sometimes we put sodium bicarb in people's IVs just to help alkalinize the body in the short term. Berberin, which is an antimicrobial herbal. Turmeric, or curcumin, we also recommend as much as possible that you cook with turmeric because it is very, very powerful, very, very beneficial. Grapefruit seed extract, which I think all of these you can probably get at the store, right? So it's not accumulation stuff. But you can get all the rest of these at Rebecca's. So just tell her you're here, just do it the right place. IV chelation therapy. Now again, traditional IV chelation therapy consists of calcium EDTA or DMPS or DMSA. However, in our office, one of the other things that also works as a chelating treatment is the IV vitamin C and glutathione. So one of the things one of the downsides of doing a more well-rounded approach to Lyme disease treatment is, as you can probably guess, this treatment can get very expensive, unfortunately. And that's because not only are some of the herbals expensive, for example, the nutrimetics here that we'll talk about in a little bit, we have Banderol and Cemento. These come from Central America or South America, I forget which. And they're very difficult to obtain. You can't get them here in the Lower Peninsula of Michigan. They're just not available. And so everything is more expensive because everything has to come here from out of state or out of country. So if we can combine multiple therapies in our office, that's what we're going to do, which is why we like to use the vitamin C glutathione IVs as an example, because it accomplishes multiple things. First of all, it helps chelate, so it helps break up biofilm. It helps stimulate adrenal recovery. And it also provides antioxidant status for your immune system to help combat the infections. And then, hence, limits inflammation, which also helps you feel good. One of the other things we use in the office is hyperbaric oxygen therapy. And the reason why this works very well is because, like any pathogen, pathogenic bacteria for the most part do not like oxygen-rich environments. And by exposing them to hyperbaric oxygen, the oxygen is forced into the body through the skin, through every orifice, through the eyes, through the soft palate, through the nose. And actually diffuses right into every tissue of your body and into your brain and spinal cord. So in people who have Lyme disease, where it's infected the brain and spinal cord, this is one of the best therapies because it will have diffuse right into the brain and force the bacteria back out into your bloodstream because it's trying to get away from the oxygen. In people who don't necessarily have the Lyme aspect symptoms, other therapies that also work very good are, one of the things we use in the office is called exercise with oxygen therapy, where we have an oxygen concentrator that's hooked up to a mask, and we wear the mask at 5 liters per minute of oxygen with very short bursts of high-intensity exercise. when it elevates your heart rate, it forces you to suck up that pure oxygen at a much faster rate, and it diffuses into your body at a much faster rate. If you don't have access to those, or in some patients, unfortunately, even those are cost prohibitive, one of the other very good alternatives is food-grade hydrogen peroxide. And you can get it, you can get it online, right? We'll get it, pure living peroxide. You can order right from them. You can do it. You can take it minute quantities orally. You can use it as in a bath. You can use it as a foot soak. There are multiple ways to get it. And again, it also helps increase the oxygen content in your blood, so that again we're kind of we're trying to drive out the pathogenic bacteria as much as possible. Plus, again, oxygen is obviously very good because oxygen is needed by all of our cells to conduct normal business. So the less we oxygenate, the harder it is for our immune system to work right in. Because oxygen is one of the weapons also with which our immune system needs to work. Of course, I already mentioned IVs. Dietary approaches also. We use a lot of lemon water to help detoxify somebody, or lime water actually as well. Some people actually think lime might be a little bit better. Of course, no sugar. I already mentioned no sugar, no caffeine. Both of them, well, caffeine increases spirit key activity, as does the electromagnetic radiation. No sugar because it knocks out your immune system. Alkaline foods, seaweed. Anybody like sushi? Sweet, good stuff. Cooked with cilantro, turmeric, and curry. Of course, curry will stink up your house for a while, but as long as that doesn't bother you, it tastes very good if you like spicy food, and it's incredibly healthy. And other antimicrobial foods, garlic and onions, dark greens, arugula, baby arugula, kale. There's a great recipe. It's very easy to do. My kids love it. We have a 5, 3, and 1-year-old. Our 2 boys, the older 2. My wife makes kale chips, basically, fresh at her house. You just take kale, break it down to basically like a potato chip size piece. Throw them in a cookie sheet with extra virgin olive oil, organic of course, and cook it at 350 for, I believe it's like 8 or 10 minutes. And they're awesome. And we can't make enough of them. Every time we get our door-to-door organic co-op order, if we get kale in it, in 2 days it's gone. Because the first thing we want to do is make kale chips. Very good, very healthy. And because it's minimally baked, it doesn't destroy all the nutrient content. And very, very healthy. Of course, a lot of people we have come in will recommend, if they haven't gotten one already, is to get like a Vitamix or something similar. Or the Montel one was the Health Master, I think. Anything that's going to help puree a lot of your greens and keep them raw, because obviously the less processing, the better. The only exception to doing the raw is the foods that actually increase vitamin content. The main one is actually carrots. The beta-carotene, vitamin A levels will increase if you cook them versus eating them raw. Turnips and beets. Other things we use, again, I already mentioned the Banderol and Cemento. Actually, there was a study out very recently to show that when you take these together, it actually is very good at killing all 3 forms of Borrelia, even just using those 2 in isolation. So they work very well. Cemento is just cat's claw. The silver we can also use. You can also get silver at Rebecca's. But actually, we prefer, when people use the liquid silver, the nano silver, to actually use it with a nebulizer or a vaporizer. And the reason being is when you take liquid silver orally, it will mix with your stomach acid and create silver chloride, which you just excrete as an inert compound. When you nebulize it and take it in and breathe it in, it goes right into your bloodstream and then stays in its active form. Then obviously able to be used by your body. Teasel or Dipsacus, again, another liquid herbal. And another big one that we use for neural Lyme disease is bee sting or bee venom therapy, or ape therapy. It's hard to find some. There are a few doctors around here. If you go to, I think it's the Michigan Ape Therapy Association, I can give you the names of people that do it. That basically amounts to stinging yourself at certain acupuncture meridian points. And it's actually one of the big uses is also for MS. I have a maternal aunt who has MS. She She lives up by Fair State. And see somebody in Wisconsin for bee venom therapy once a month. And as long as she gets her bee stings, she walks and ambulates fine. If she goes too long without it, her right leg becomes paralyzed, she can't move. And so it's quite an interesting therapy for sure. Detoxification. One of the things that can happen, and the reason why it's so important to make sure that the person's detoxification pathways are working well, is that once you start to kill off the Borrelia, they will release toxin into the bloodstream. And because of that, if you kill off too many too fast, you end up with what's called a Herxheimer reaction, which makes you feel worse. And for anybody who's experienced it, even far worse than what you did before treatment started in some cases. So these are the things that we have people do to prevent these reactions, or at least minimize how you feel when you have a reaction. Again, one of the common things here, glutathione. So whether I give it inhaled or we give it by IV, guess what? You're going to, here's yet another use for glutathione. Kombucha, which is a tea that's fermented, and it's actually incredibly good. I don't remember which flavor it is. I think it's a grape chia.
This is a grapefruit ginger.
Okay. But I don't remember which flavor it is. The one my wife always orders, but it's got like 4,500 milligrams of omega-3 fatty acids in it. So incredibly beneficial, especially for this type of scenario, where you really need a lot of anti-inflammatory compounds in the system. And omega-3s being one of them on the list that we talked about, especially for immune-enhancing properties. So if you go to the store, she can help find it. Chlorella, sun chlorella is what we typically go off of. There are several brands. Milk thistle, which helps the liver detoxify your bloodstream. Quercetin, which is another antioxidant that's very similar to vitamin C. In the office, we also use far-infrared sauna therapy. Some people have this at their home. But the sauna is very good for basically sweating out a lot of the toxin. Again, I already mentioned before, the Epsom salt or the magnesium salt baths. One of the ones that we sent people for is called Ancient Minerals, and it's just pure magnesium flakes. And you put right in the bathtub and use. Or they also will make a transdermal gel, which you can rub on your skin and soak in that. Dandelion root and then sarsaparilla are also two that will minimize these reactions from taking place. And these are very important. I don't mean to minimize any of these in any way, because anybody who has had this reaction, and anytime if you guys start going online and researching and you start to go like some of the online Lyme disease communities and blogs and so forth, and forums, most of what they're talking about is how am I minimizing the symptoms of this Herxheimer reaction. They call it Herxing for short. Because this can put you right on your blood very fast and you start to kill the stuff off too quickly.
Have you just heard, I did a lot of reading on the strategy, and now they're doing B3 niacin or niacinamide up to 5,000 milligrams a day of pain. So they really boost the system really fast. Have you heard that?
Yeah, I have. It boosts the system fast because obviously, as most people may be aware already, niacin is a natural diuretic. So anything you do to flush the system, because niacin causes a flushing of the system, it will work very well for that. So yeah, I have heard that actually just recently, within the last month I heard that. And we haven't tried it yet in office, but I'm anxious to.
What about neem too? Now that has the herb neem, that has a lot of properties in a lot of things about that
when we're trying to prevent this, for the herbal aspect, because the person is probably already on a lot of herbals, we try to limit the amount of herbals because of their cost. So especially with this stuff, we're going to try to refer more to this as an example, because believe it or not, the Epsom salt, everybody, the Epsom salt is very cheap, very easy to get, any store carries it. Sun chlorella is fairly inexpensive. Kombucha is pretty inexpensive for how healthy it is comparatively. And also some of the other things they're already on. Vitamin C, glutathione will also help prevent the Herxheimer reactions. So it's just, for me, it's not that there are probably another whole double of this list for things that will help this. But again, I'm trying to minimize it to the things that I can combine to accomplish multiple benefits to try to save on cost. Really my primary goal. These are the resources. Earthing Institute is for the earthing blankets. There are a couple of good Lyme books. One is called Insights into Lyme Disease Treatment. And I think it's like 12 or 13 different doctors that treat Lyme disease, and kind of gives you a perspective on their treatment protocols. A lot of which you might see in here, or even some that we don't do. Antenna search, actually this is quite interesting. You can go on and type in your address, and you can find how many cell phone or radio towers are within a certain radius of your home. And they actually recommend, a lot of like these sites down here, the people who are really advocating against electromagnetic radiation, will recommend that you should have less than 6 to 8 within a 4-mile radius of your house. But it's not uncommon for people to have 30 to 50 within a 4-mile radius of your house, depending on where you live. So this is not to be taken lightly. This is the Destructive Interference website, Mnemon Your Harmony. You can go on here and find all the products that help counteract the Wi-Fi and all the radio frequency that you get and absorb. Same thing, lessdmf.com, and also down Stetzer Electric. This is also, we actually had a patient referred in. She actually suffered from electrical poisoning because her house, she has a recently built house that was built 8 or 10 years ago. And when the energy company came in to install the wiring from the house to the road, to the pole, they didn't install enough wires, so the entire house was basically constantly in a brownout for almost 10 years. And of course, it ended up frying her neurologically. And now, all of a sudden, she has many neurological symptoms as a result of it. She's been treated for it now for about 6 months and has been doing a lot better. And was recently referred in to us for the same thing. But one of the things she had to do was she went to a site like this one to find out different products that she could get around her house to minimize the electrical output and the frequency coming out of all of your appliances and all of your other electrical devices in your home. You know, most people don't realize, if I have a toaster oven on my counter, if it's off, but it's plugged into the wall, it's still emitting electrical energy. And a lot of people don't understand that. And so it's important, if you're not using something electric, that it be totally unplugged. Now, of course, your stove, your oven, your refrigerator, things like that, you can't unplug those, it would be practical. But another one, of course, like we've done long ago, is, get rid of your microwave, please. The microwaves are probably one of the worst things that we have in the house. I didn't throw that on. Also, another thing, we talked about the Candida and some other stuff. There's one down here at the very bottom, it's Ermi mold test. One of the other problems a lot of people have, especially with the mycoplasma, is that they can have a lot of mold problems in their house. And there can be mold spores in their house that they're sensitive to and not realizing. And that being a constant source of inflammation and immune response. Again, potentially triggering autoimmune responses. But one of the most common types of mold is something called aspergillus, which produces something called aflatoxin. And it's actually one of the most common sources of aspergillus is in peanuts. And so one of the things that we also have people advise people against is to just totally not eat peanuts whatsoever. Because the reason peanuts mold is because they have such a high mold content. And that mold produces toxins that are very toxic to your nervous system and allow your nervous system then to create autoimmune responses. So I would do things like switch to almond butter, which is a far healthier source. And also I would also go a step further and say raw almond butter, which you could get even just at Kroger. Kroger carries it in their little Nature's Market section. That's what we use. Our kids know no different because they've never had peanut butter, thankfully. I can't say they probably haven't had a peanut M&M time or two, but that's when Grandma and Grandpa are around and they get it. But what this does is this company, when you go on this website, they will send you a free kit to test the mold in the air in your house. And I forget the exact mechanism, but it's just basically all you give is a dust sample from your house, and it checks for the presence of DNA to something like 50 or 60 different types of mold. So it's a very, very extensive test. But again, they send you the kit for free. So it's a test worth doing, especially if maybe you have a house or a good part of it's built into the ground. Or you have a very damp basement, maybe you have a Michigan basement, stuff like that would be worth testing. And finally, I have no good time, but I think I'm throats up and talking. So, any questions?
Can you do that recipe again for the kale?
Kale, yeah, you just obviously you want organic kale. Anything that I ever say, just assume it's organic. Break it up into manageable sizes, like about the size of a potato chip. Put it on the tray. Basically drizzle extra virgin olive oil over it. And you can do a little bit of salt and pepper, like we use real salt, or some people use sea salt, unprocessed salt basically, to taste. And then throw that in the oven at 350 for about 10 minutes, 8-10 minutes. Comes out, tastes very cool for a minute, like you still want it when it's warm, because that's when it tastes the best. And that's when our kids basically eat the whole tray and everything else.
This is a great lecture. But you have it on CD, so a lot of work.
That's why I wrote a word.
Oh, okay. So eventually it'll come out.
So eventually it'll be out somewhere. I'm sure it'll be on YouTube or something. I'll get a copy of it myself, but it's wherever we're back.
Thank you very much.
Good Lord,